Since 2015, I had slight symptoms, but then in 2020, after having COVID, I started to have like a long COVID symptoms, and I've been after diagnosed with could be vestibular migraine. It affects massively everything, my lifestyle in general. Work, I had to reduce work massively, which before I was able to do normal hours of work. Now I have to reduce it. Part-time, even part-time, I struggle because I get very tired. I have very strong sensitivity to light that impacts, and it's a trigger of my symptoms, which cause dizziness, lightheadedness. So I've seen the vestibular therapist. I've done the therapy for months, didn't work out, no improvements. Then I've seen another vestibular therapist, which gave me exercises, which again didn't really done anything for me. So the clinic came up on my Google because I was looking into stem cells and regenerative therapies, and this is how I found Swiss Medica. It helps so many conditions, so I thought maybe this could be the answer. Now, yes, it was very easy communication. Yes, and they seem very professional, which I liked as well, because they sent me all kind of information beforehand, so I had that very clear from the beginning. Yes, I think the treatment went exactly according to the plan I had, and the physio as well. Actually, it was more than I expected. I mean, I had lots of treatment done, and I was very looked after in the physio room as well. So the staff there, they are very nice as well, and all the nurses and everyone, the doctor, and yes, very happy with everyone really.
Good afternoon. Would you please let our viewers know where you come from and which condition brought you to our clinic?
Yeah, so I originally am from Romania, but I come from England. I live in England, and I suffer with this condition since, since 2015. I had slight symptoms, but then in 2020, after having COVID, I started to have like a long COVID symptoms, and I've been after diagnosed with could be vestibular migraine, but it's still very unknown. Yes, it's very unknown. Like I never been told like for sure this is what it is. They said it could be because the symptoms I'm having, they are very similar to, which is vestibular migraine.
I see. Right now, on an everyday basis, what kind of challenging you're facing? Like how does it affect you every day?
It affects massively everything, my lifestyle in general. Work, I had to reduce work massively, which before I was able to do normal hours of work. Now I have to reduce it. Part-time, even part-time, I struggle. Because I get very tired. I have very strong sensitivity to light, mostly artificial lights, and because obviously I work indoors and I have to work with strong lights, that impacts, and it's a trigger of my symptoms, which cause dizziness, lightheadedness, anxiety feeling, makes me feel sick sometimes. I have to be in the dark. Yes, I mean, I'm affected. For example, if I go to supermarkets, I get very dizzy in supermarkets because of all the things around.
These neon lights.
Yes, the lights and
what about the noise?
busy environment, because there are so many products around, people, movement. That makes me feel very dizzy and very uncomfortable. Sometimes I just have to leave everything I do and go home. I get sick in the car, very, very sick. If I'm a passenger, like, I have to sometimes just close my eyes, not look at the road, because it makes me feel very, very, very sick, very dizzy, very unstable. Yes, I mean, after I had the COVID, because that happened exactly about 2-3 weeks post-COVID, I was very ill for about 2 years. More, I would say, more than I am now. Like, I had like arms, pins and needles in my arms constantly. I used to bump into things in the house when I would move around. I had tinnitus day and night. Yeah, massive dizziness and lightheadedness, tremors, all kind of like neurological symptoms. And then after about 2 or 3 years, I would say in 2023, it started to subside a bit. So it got a bit better, but I'm still not feeling well. It got better in terms of my tinnitus is not as bad anymore. I don't have as much the tremors and the pins and needles in my arms. So that got a bit better, but I still suffer with this light sensitivity. Sometimes I have to just wear like sunglasses indoors. Yes, it has a lot of impact because I get really, really tired, which before I wasn't like this. It's just like something all of a sudden hit me, and it just changed everything of my physical condition.
What kind of medical help do the doctors offer to you?
Over
Did they
the
offer
years?
to you, yeah, like especially when you had those 3 years of being really sick.
Because we were in COVID, right at the beginning, it was a bit hard to see doctors, but I have been seen in emergency room, and as they thought I might have a stroke because of the symptoms I was describing. So I had MRIs done, different scans done, like different like checkups, but no answer was given to me at the time. They were just saying that from those tests everything seems to be okay. So I've got no answers at all until I went privately. By doing lots of research and researching my symptoms, I thought it's something related to the inner ear, to the vestibular system, which is in the inner ear. So I went to an ENT doctor, which is an ear, nose and throat doctor, and he suggested to go to see a vestibular therapist, which that's because the ears seem to be okay, healthy, no infections in the ears that could have caused the dizziness and the other symptoms. So I've seen the vestibular therapist. I've done the therapy for months, didn't work out, no improvements. Then I've seen another vestibular therapist, which gave me exercises, which again didn't really done anything for me. So he said that it could be vestibular migraine because I'm not responding to these exercises. It's something more serious, more probably medication is needed. So he suggested to go and investigate if it's vestibular migraine. And this is how I ended up seeing a doctor through the NHS in England, and I've been referred to the audiology specialty, and like a neuro-audiologist doctor that saw me, and they ran a few tests, which again they came out okay, and because they didn't have like proper answers, they treated me with medication for vestibular migraine. So I've tried a different type of medication over the years, which hasn't worked in any way. Like I haven't seen no improvement.
So how did you
And
come
then
up with this idea?
just because that happened, and then I went privately again to a different, like I've lost count of how many doctors I've seen.
I bet, yeah.
So I've seen different specialists in the UK privately that prescribed as well medication for this called vestibular migraine, which again didn't work. Then I've seen a neurologist in Romania, which said that it could be sleep apnea, and he suggested to do a sleep apnea test, which came out positive again, like not positive in the way, like it came out like it's no sleep apnea. Then he suggested to go and see again an ears, nose and throat doctor. I've seen another specialist there. He said it's not related to that, and he said, okay, let's do an EEG for the brain, and that came out okay as well. So he was, well, I don't know. Basically, I'm just gonna prescribe you medicine for migraine because I don't know what it is. We've done so many tests, and nothing else doesn't come up. So it's a bit of a mystery because for him as well, he was like, well, your symptoms, they are a bit strange for a migraine. It doesn't look like a migraine, but because other tests doesn't tell me anything, maybe it's some sort of a rare form of migraine after the COVID. So he prescribed another type of medicine, which again didn't work. So I just started to do lots of research myself, and I looked for regenerative treatments, something that is that can help heal the body more naturally, rather than keep taking medication which doesn't really help me in any way. And this is how the clinic came up on my Google, because I was looking into stem cells and regenerative therapies, and this is how I found Swiss Medica.
Have you considered any other clinics apart from this?
Yes, I have considered a clinic in America, which they do regenerative therapies, but not stem cells. It's a different approach. More like light therapy, different lasers they use, saunas for detoxification, and so it's a different type of approach, not stem cells. And I have considered
what helped you to make up your mind and to come to
believe
surgery?
me, that was a very hard decision for me to which one to choose. But I don't know, I think I just had a feeling, you know, when you have a gut feeling, oh, maybe this could be better or could help me a bit more. So yes, it wasn't based on anything else really, because yes, I just had that gut feeling of, you know, stem cells are so researched now, and it's supposed to it helps so many conditions. So I thought, because what I have, it's kind of a mystery still, I thought maybe this could be the answer. Now, fingers crossed, it works well for me.
Like, how did you establish the communication with our medical advisor? And how was it? Was it smooth?
Yes.
Were all your answered?
Yes, I think it was very, very smooth, very professional. They always been very prompt on giving my responses or any questions I had. They were very quick to answer my questions. So yes, it was very, very easy communication. Yes, yes. And they seem very professional, which I liked as well, because they sent me all kind of information beforehand, so I had that very clear from the beginning. Yes.
Have you had some fear coming to our clinic? And if you had, what helped you to overcome that fear?
Fear,
Maybe
my
you've been
biggest
cautious.
fear was the only thing that maybe it won't work for me. That was the
That's the
fear I
only.
had, the doubt, the unknown of what if I do this and it's not going to help me. But I have to be positive and think that it will help me, and yes, hopefully. But apart of that, I didn't have no other fears. I felt quite secure and welcomed, and yeah.
As far as the medical part of your stay here is concerned, is it the same like you imagine? I mean, your treatment plan, what does it consist of? A little bit about it. You also have some physiotherapy going along with it.
Yes,
right?
yes. Yes, I think the treatment went exactly according to the plan I had. Yes, and the physio as well. Actually, it was more than I expected. I mean, I had lots of treatment done, and I was very looked after in the physio room as well. So the staff there, they are very nice as well, and all the nurses and everyone, the doctor, and yes, very happy with everyone really.
So,
Yes.
do you want to say that before coming here, you already had your treatment plan, which is now being followed up, right?
Yes, yes. So I have been sent a treatment plan
Before
based on
coming.
my needs and based on my budget, everything, before coming. So everything was very clear on what to expect, and everything was followed according to plan. I had my test done, my stem cells, I had exosomes IV, all the infusions with the vitamins, the physio part with the blood laser irradiation, I think it's called. I had that, and I also had TENS and some other machines for my neck pain. So that was a bonus, which I really appreciate them for looking after me like that. So yes, that was really good, really good. Everything went smoothly. Everything, yeah,
A couple of
feels good.
words about the accommodation and the food over here.
Mm-hmm.
We want to let our patients to know that we take care of accommodation and food as well.
Yes, very happy. Really like the room. Absolutely spotless, very beautiful, very nice, like a hotel, like a 5-star hotel. Very clean. They clean your room every day. The food is really nice. Also the staff at the restaurant, very nice. So well done to everyone here. Like they are really nice, very friendly. They are trying to accommodate you as much as they can. If you have like any specific needs, or you can always request. They are trying always to be very helpful with what you need. So very happy with the accommodation and the restaurant, and yeah, very happy with everything really.
With the stem cell therapy, you might see the results after 2, 3, even 4 months. So
Yes.
now it is too early to talk about any results.
Yes.
But if there are some, when there are some, what are you expecting them to be? Like what aspects of your condition you would like to be improved?
I mean, I am very realistic in terms of I know that probably this won't go away completely, but I'm hoping maybe at least 50% of what I'm feeling, it would make a massive difference for me if I would have a 50% of my symptoms to go down a bit, so I don't have them like constantly every day of my life. If it would reduce the days or the hours of the day, if that would help, that would be a massive improvement for me, and I would be very happy and grateful if that would happen. Definitely. definitely.
All right, thank you so much for sharing your story with us.
Yes, no
Thanks.
problem.